let's just have a quick recall, right? So I will briefly take you through the blood, its components, the PRP composition, indications of PRP, its contraindications, its side effects, complications, and the mechanism of action. How does PRP work? So these are the blood components जो आप लोगों ने FSC में भी पढ़े होंगे, याद होंगे. So these are the RBCs, WBCs, erythrocytes. Then there are WBCs, also known as the leukocytes, platelets, thrombocytes, and the plasma. This is a further elaboration of the different components of blood in the test tube. As you can see, the part at the bottom of the vial that is made up of 45% is the RBC of RBCs. Then major component is plasma, 55%, that is further composed of proteins, water, and other fluids. So the remaining 1%, or you can say the less than 1% part, is made up of platelets and WBCs, and that is of our main concern. So PRP, what is PRP? PRP, platelet-rich plasma, is basically the plasma with a high concentration of platelets plus a large amount of proteins in it, and of course some water content. So as we all know that the basic function of a platelet is just to clot the blood, and platelets alone do not have any restorative or heal or any kind of magic healing properties. So how come platelet-rich plasma are doing all the miracles? There must be something in them why these are so much powerful. And let's have a look what can PRP can do. First of all, okay, now so PRP, it accelerates endothelial, epithelial, and epidermal regeneration. It stimulates angiogenesis. It enhances collagen synthesis. It promotes soft tissue healing. It decreases dermal scarring. It enhances hemostatic response to injury, and it can reverse the inhibition of wound healing caused by steroids. So how come? So now you have to ask the question, like, how come a PRP can do such and such magic work when its main component is just platelet? And we all know that platelets can only clot the blood. But no, let's not underestimate the power of a platelet, because platelet has a lot of things in it. And let me show you the slide. So as you can see, oops, what did I do? Okay, it's gone. चलिए दोबारा कर लेते हैं. G. Okay. So as you can see, now the platelet has lysosomes in it. It has dense granules, and then it has alpha granules. Now in lysosomes, there are so many enzymes in it, like elastase, collagenase, and then there's beta galactosidase and beta glucuronidase. So all these enzymes, these are involved in different paths of coagulation, as well as wound healing, and plus vasoconstriction of the blood vessels to stop the bleeding. Same goes for the dense granules, the ADP, ATP, serotonin, calcium, epinephrine, histamine, and you know the functions of all these components. Now coming to the alpha granules, let me use my annotated marker. Okay, now let me come here on this part, alpha granules. So it has the coagulation factors, chemokines, which cause inflammatory response. Then there are adhesion molecules that are useful, or their function is to make a clot. And then their immunological molecules, they just initiate the immune response. And then the most important of our main concern, the regulators of the growth and the angiogenesis. Now, we will not go in the details of all these. A few of these are irrelevant components. Our main components are these, and let's focus here. So over here, as you can see, these are the main growth factors that are released by the platelets. So first of all, you have to know that how platelets work. Platelets get activated and they degranulate. And when they degranulate, they release these growth factors. Now, these growth factors, what they do? These growth factors, they attract the stem cells, and that's how the magic begins. Now, these growth factors, some of the growth factors that are very important, like PDGF, platelet-derived growth factor, then vascular endothelial growth factor, fibroblast growth factor, epithelial growth factor, and transforming growth factor. Now, their function, as you can see, is PDGF is it helps in cell growth, new generation and repair of blood vessels, and lastly, the collagen production, the very important. And then there's, as the name indicates, the vascular endothelial growth factor. It helps in growth and new generation of the vascular endothelial cell. Fibroblast, again, of importance, like it can cause tissue repair, cell growth, collagen production, hyaluronic acid production. Okay, then epithelial growth factors, as the name indicates, it's helpful in the promotion of epithelial growth cell growth, angiogenesis, promotion of wound healing. And the lastly, transforming growth factor. Growth factor, it helps in the help improve the growth and neogenesis of epithelial cells, vascular endothelial cells, and promotion of wound healing. So these are the growth factors which actually work for platelets. After being released from the platelet, they attract the stem cells, and then the whole magic work has been done. Okay, next slide. Okay, now different uses of platelet-rich plasma. When I will show you different functions of platelet-rich plasma, PRP, you will be astonished, because you might be thinking that we have pain physicians here, so they might. I'm not saying that all pain physicians think like that. I'm just saying few of you might be thinking that we use PRP in the knee joint, on the shoulder joint, or in the back. And some of if we have some aesthetic people who work for aesthetics, they might be thinking we can use PRP for hair growth and for the skin scarring and all this. But let me show you what PRP can do. So as you can see, PRP is doing wonders since 1983, and with the passage of time, its function and its usefulness has been revolutionized, or you can say evolutionized. So from 1983, like its use was like in 1983, it was initially used for the treatment of ulcers, and then gradually with the passage of time, it was used in orthopedics for the first time, and maxillofacial surgery, and then arthroscopic surgeries. In 2007, it was incorporated in sports medicine, and cosmetic surgery. Now, let me show you some other things what PRP can do. Okay, this is very important for all the pain physicians here. Let me use the marker. Yeah, okay. So as you can see, now this is a whole musculoskeletal system. I hope and nothing has been missed here. So let me explain different parts. Now, PRP can be used starting from the hand and wrist. So PRP can be used like in the ligament sprains, triangular fibrocartilage complex. In the knee, very important. In the patellar tendonitis, meniscal injuries for ligaments. And then in the ankle, they can be used for plantar fasciitis, Achilles tendonitis, and ankle sprains. Coming to the shoulder injuries, the rotator PRP is used, not can be used. It is being in use for the rotator cuff tendonitis and some partial tears. Anterior and posterior band of IGHL. What is IGHL? It is inferior glenohumeral ligament. Then the PRP is also used in the different joints and ligament, that is AC joint. AC joint is the acromioclavicular joint, then sternoclavicular joint, and then coracoclavicular ligament. The SLAP-EN. SLAP-EN stands for superior labrum anterior posterior. It is basically it's a tear in a labrum. So PRP can be used in the shoulder for different kind of pathologies at different sites, right? Now coming to the elbow, you might be familiar with the term of lateral epicondylitis and medial epicondylitis, but they have other names. So medial epicondylitis, also known as golfer's elbow, while lateral epicondylitis is also known as tennis elbow. Sorry, excuse me. So, okay. So now coming to the back and hip. So PRP is also being in use in the facet joint arthritis, sacroiliac joint pain, in hip girdle muscle pain, in hamstring tendinitis. So let's have a look on another slide. Now this is the most attractive slide for the people who are working in aesthetics. As you all know, the PRP is being used for the skin rejuvenation, fine and deep wrinkle blurring, acne scar, stretch marks, and hair loss, and so many more other things. So in the dental cosmetics, PRP along with the stem cells is also being used, as you can see from this self-explanatory picture. And then very importantly, for the female infertility and the male infertility, PRP is also doing miracles. So now these were all the indications. I hope few of the indications might be new for our members, our audience here. So about contraindications, when there are indications, there will be also some contraindications. So be very, very cautious. Let's have a look. What are the contraindications of PRP? Okay, active skin diseases. If your patient is having SLE or porphyria and some other local skin infection, do not try PRP on their skin. Cancer chemotherapy, do not try PRP in cancer chemotherapy patients. Then abnormal platelet function. Of course, if the platelet function is abnormal, it won't be of any use if you're going to inject the patient with the PRP that is having abnormal platelets. Then of course this won't cause any good for the patient. Now about NSAIDs, if patient is taking NSAIDs, so during that period, or if patient has taken the NSAIDs 1 week before the PRP session, so try avoid PRP during that time. And if patient have any history of recent stroke means cardiovascular accident, and then heavy cigarette smokers. So because heavy cigarette smoking can alter the function of platelets, so it won't be of any advantage to give PRP to such patients. And lastly, hypertrophic diseases like keloid formation, angiogenesis-based diseases, psoriasis. As I have already mentioned, if patient is having any kind of skin rash or disease, try avoid PRP in them. And then the last one is severe metabolic and systemic diseases, like for example, uncontrolled diabetes mellitus or thyrotoxicosis. Right? So next one. Okay. Now, as you can see this slide, the natural therapy with no side effects, platelet-rich plasma is 100% natural treatment for skin regeneration. Guys, do not believe her, because every action has a reaction, and it's not possible that you are doing any sensitive medical intervention and there won't be any side effects. So don't fall for this these kind of posters or things if you see anywhere, because there are some side effects or complications of every medical intervention. So let's have a look. So there are some common and some uncommon but serious complications and side effects of PRP injection. So pain, yes, don't underestimate the pain. Sometimes when you give PRP in the joints, it is very, very, very painful, extremely excruciating painful. So don't just underestimate the pain. You might be thinking कि थोड़ा सा pain होगा हम देख लेंगे. No, it's not just थोड़ा सा pain. It's not a little pain. It's a lot of pain. Then discomfort. Yeah, discomfort is just very like convenient side effect, acceptable. Swelling. There will be bruising. If you are not very careful, there will be bruising all around. And then skin irritation. Now about the uncommon one, and of course the redness. So some very uncommon but serious complication can occur, like allergic reactions, and then nerve damage, God forbid, and then infection, and then vascular occlusion. So be very, very careful when you are trying to inject PRP in any part of the body of a patient. You have to be very, very careful. Don't just be over enthusiastic, and don't be overconfident, and don't be just like so naive that that you don't know that a PRP can cause all these things, right? So about PRP, another thing about PRP, that why we use autologous blood. Why we cannot use the blood from someone else or some other patient? Because of the reason, because it's physiologically compatible, there's low risk of adverse reaction, and then it's biodegradable by the body enzymes. Now, this slide is very important because sometimes you came across the patients, or might be your own self, your family members, they might be saying, "Humne PRP karwaya tha, hame farak nahi pada." They will say that we have received a session of PRP and that was not very useful. So there might be different factors that affect the efficacy of PRP. Let's have a look what kind of factors these are. So the patient-related factors and PRP preparation-related techniques.